All right, let's talk about 2026. For Mexico, this isn't just another year on the calendar. It's shaping up to be a serious deadline. We're about to see the country's health system put under the ultimate test. And trust me, the time for just talking about ideas is completely over.
So let's just dive right in. In 2026, the entire world is going to be watching Mexico as it co-hosts the FIFA World Cup. Now, just think about that for a second. A massive wave of people pouring in, cities buzzing like never before, all under a global spotlight. You know, any big event like this puts a system under pressure. But this is on another level. It's the kind of pressure that reveals what a system is really made of. So the big question isn't just can they handle it? It's can this moment actually forge a stronger, more resilient health system for everyone in the long run?
To help us unpack all of this, we're going to lean on the insights of Dr. Victor Andrade Carmona. Now, he's not just a medical researcher. He's a specialist in health management, and he operates at this really critical intersection. You know, where the very real human experience of being a patient meets those high-level strategic decisions that affect the entire system.
And look, Dr. Andre's work has some serious real-world applications. So we just wanted to quickly mention that if anyone's interested in his expertise for things like consulting, sponsorships, or other collaborations, his contact info is right there on the screen. His expertise is exactly what we'll be exploring throughout this whole analysis.
So, what is the single biggest problem we're talking about? Well, Dr. Andrade has a fantastic word for it: friction. And listen, this isn't about one single catastrophic system failure. No, it's that slow, daily grind. You know what I'm talking about. The mountains of paperwork, the patient files that are never where they should be, all the administrative hoops you have to jump through. It's the stuff that wears down not just patients and their families, but the very doctors and nurses who are trying to help them.
And this quote from Dr. Andrade, man, it just perfectly captures the human cost of all that friction. He says, people don't lose trust because of one mistake. They lose it because of 1,000 micro-frictions that add up. Wow. It's not about one big scandal. It's the slow drip erosion of your faith in a system that just feels like it's constantly working against you.
Okay, so how do we actually fight this friction? Well, Dr. Andrade lays out a super clear 4-pillar plan. And what I find so fascinating is that it doesn't start with, buying some fancy new technology. It starts by rebuilding the fundamental human experience of healthcare. Let's walk through it.
Pillar 1 is all about operational trust. And this is not some vague, fuzzy idea. We're talking about the simple, repeatable experience of a system that actually does what it's supposed to do when you need it. It means your test results are written in a way you can actually understand. It means your appointment is on time. And it means you aren't blindsided by hidden costs. It's all about making healthcare predictable and reliable. Simple as that.
Now for the second pillar, we see this huge shift in thinking. We're moving away from simply reacting to sickness to what Dr. Andrade calls useful prevention. I mean, for decades, the model has been to just wait for people to get sick and then try to fix them. This new approach is about proactively designing simple, easy-to-follow paths to help people stay healthy in the first place, making things like vaccinations, early risk checks, and health plans not just available, but truly accessible.
The third pillar is absolutely essential in our digital world: data governance. Just think about it for a second. Your medical records being scattered all over the place isn't just an inconvenience, it's genuinely dangerous. It leads to medical mistakes, repeated tests, and just a massive amount of waste. So the key insight here is that managing data isn't just an IT project, it has to be treated as a core part of health policy itself.
And finally, the fourth pillar connects our health directly to the economy. It's called strategic workplace health. This totally reframes employee health. It's not a cost to be managed. It's a key driver of national productivity. And we're not just talking about putting a ping pong table in the break room. No, this is about a fundamental redesign of work itself, rethinking schedules, prioritizing rest and mental health, and making sure people have real access to quality care.
This all leads us to a really powerful new way of thinking about innovation. Dr. Andrade argues that in healthcare, real innovation isn't about the newest gadget or the shiniest piece of tech. It's actually the difficult but totally essential work of translation. It's about turning complex data into clear actions. It's about turning scientific evidence into daily habits. And most importantly, it's about translating technology into human trust.
You see, this completely changes the role of the doctor. In an age where we're drowning in information, and let's be honest, a lot of misinformation, the physician has to evolve. They have to become more than just a clinician. They need to be a community leader, a trusted guide who can take all of this overwhelming complexity and translate it into clear, simple advice, whether it's for one patient or an entire organization.
And of course, we can't talk about the future without talking about AI. Right now, we are at a major fork in the road. We have a choice.
On one hand, we can use AI to just automate the existing confusion, basically just doing the wrong things faster. Or we can harness its real power to actively get rid of that friction we've been talking about, freeing up doctors' time and empowering patients with actual clarity. The choice is really up to us.
So what's the bottom line here? Dr. Andrea leaves us with a pretty stark warning. The pressures of 2026, whether they come from the World Cup or just the global economy, will not be kind to systems that are still running on guesswork and a lack of transparency. But for a system that's ready to embrace simplicity, clear communication, and a deep investment in trust, 2026 could actually be a defining year for progress.
Okay, before we finish up, just a quick but important reminder. This content is for educational purposes. It is absolutely not a substitute for professional medical advice. If you're experiencing any symptoms or have an emergency, please seek help from a healthcare professional immediately.
Hey, thanks so much for joining us for this deep dive into the future of Mexico's health system. What do you think about this four-pillar plan? We'd love to hear your thoughts down in the comments. And if you found this analysis useful, please share it with someone. And of course, be sure to subscribe for more breakdowns of the critical issues that are shaping our world.